providers advancing school outcomes. And it's run by the Statewide Parent Coalition, where where two Latina kind of health advocates work with family, friend, and neighbor providers who care for children, a variety of ages, and could be anywhere from 2 children to up to 10 children per provider's home. So we were really excited to work with these TIAs to bring information about healthy eating, active living back to those providers. And so overall, we think we reached about 1,000 children with this group. And it was a real mix of participation in terms of we had some directors, assistant directors, teachers, cooks, and we tried to get 2 people from each program just so that they would have kind of a team representing their center and be able to bring it back to their group. You go to the next slide. So our structure was we did 12 hours of training over 3.5 months, and we did one Saturday per month. The training was from 9 to about 1:30. We were very fortunate on our staff. We've got a real variety of experts. We have an early childhood specialist, a dietitian, our environmental health specialist who does all the childcare health inspections in Boulder County. And we were fortunate to get a representative from CACFP to come and present about their program. We also did monthly mentoring or coaching sessions, about an hour per month with each site, as well as with those TIAs. Here's the next slide. When we first started out, this was last fall, we used all the materials came from Let's Move Childcare. We kind of used parts of their PowerPoints in our training and a lot of their materials, as well as we used the I Am Moving, I Am Learning curriculum, IMIL, for the physical activity part of the training. Next slide. And then after doing that, we kind of, the Let's Move materials were excellent, but they were kind of, they were a little bit hard for us to organize, and there was just so many of them. We kind of were just looking for a slightly different curriculum to work with, and so we found that 5210 goes to Childcare Toolkit, and 5210 used a lot of Let's Move materials, but just made it even more specific, we felt, to work with childcare providers. And it comes with an excellent resource manual that we ended up purchasing for each of the sites that we worked with. It was just kind of on this nice, neat little package. It came with an excellent assessment tool that I'll talk about in a minute. And this manual cost us about $65 per site, and it just was very, very comprehensive. So we used this for the second cohort that was in the spring. And the way our sessions were kind of set up was the first session was all about physical activity, screen time, and sleep. And then the second and third sessions were all about foods and beverages served, eating behaviors, how the providers interacted with children around feeding and mealtime. We did menu planning with them in this session, in these 2 sessions, and as well as really encouraged participation in CACFP, as well as having the direct person from CACFP come in and present. And all 3 of our sessions had a big policy focus. So at the end of, or during each session, we talked about now what are your current policies and how can you rewrite your policies so they really encourage the best practice procedures in these different areas. The other thing we did was give them a jump drive with materials on it. So if they didn't want to deal with this big notebook, they had it all on a jump drive that they could print from, store easily. Next slide. So in terms of the pre and post assessments and evaluation we did, For the first cohort, we used the Let's Move self-assessment questionnaires, and again, there were so many of them, they were kind of hard for us to keep track of, as well as get the center staff to fill them out. And so in the second cohort, we moved to that 5210 self-assessment checklist, which was much easier to work with. And so I'm going to talk mostly about that 5210 assessment that we use, because that's one we're going to continue to use. So it had these different sections highlighted: foods and beverages that they were serving, infant feeding, physical activity, screen time, supportive strategies, and these were things like staff wellness programs that they might have, whether they ever worked with grocery stores in the neighborhood, farms in the area, food banks, whether they ever had health professionals come in and talk about health and wellness and good nutrition and that kind of thing. And then program policies. Then we looked at CACFP participation pre and post program to see if all the information we gave them convinced them to sign up for CACFP. We also looked at menu analysis. We did a menu analysis kind of at the end of the spring cohort, but in the future we plan to do a pre and post menu analysis to really see if we can measure those changes and what they're actually serving. And then very long-term evaluation, we plan to have our childcare health inspector go in and see if they maintain their changes. Next slide, please. And so I'm just going to take you through the data a little bit. I have about 3 or 4 slides just on what our data showed after programs going through our HEAL program. And the way the assessment was set up is they could get a maximum of 4 points for each question under each of these activities. So we totaled their points. We did a had them do the pre-assessment. We totaled their points. Then we had them do a post-assessment, the same assessment, just one before the program started and one after. And then we just looked at the different points that they scored in these different areas. And you can see, so on this slide, the light blue color indicates the pre-intervention scores, and the dark blue indicates the increase in points that they got. And then the star just indicates the maximum possible points on the assessment. So, and this is an average across all child care centers. Some centers had more movement in different areas, so we're just really looking at this in an aggregate kind of way. And then the last slide I'm going to show you is more how different centers did on scoring points. So you can see on here that they were doing pretty well even in the pre-assessment period. So, and you can tell also from this slide how much they improved after going through the class. So for us, it kind of looked like, wow, they're actually doing pretty well here. They improved in all areas kind of across the board, and they still have room to grow to meet a maximum score that they could achieve. Can I have the next slide, please? Okay, so this chart represents the average change in scores from pre to post across the centers, and this is an average of the scores across all child care centers. So you can see here that they made the most progress, interestingly enough, in the supportive strategies area. So centers were able to do more around staff wellness, as well as reaching out to the community and having people come from the community into the centers and making connections with some key, physical activity and nutrition experts in the community. So they improved quite a bit in that area. Next slide, please. Okay, so we still have more work to be done. this chart tells us how close we are to our goal in each area by looking at the average post-intervention scores. And as you can see, we're, like, for program policies, they did so well. They got so close to, achieving kind of a perfect score on getting program policies in place. So the next thing we would hope to look for is, are they implementing the policies that they actually set? So they were very successful in creating these policies, but will they be able to implement them? Kind of another area that, even though they came a long way in their supportive strategies work, they still have quite a bit to go to achieve a maximum score in this area. So we will be looking at how we can help them continue to partner with the community to improve their HEAL activities. And then the last one that I wanted to point out is physical activity. And we were kind of surprised that they had a harder time improving their scores in this area. And we kind of looked into what some of those barriers were. And they had trouble meeting kind of the recommended minutes per day of structured and unstructured physical movement or activity for the kids. And some of the things they said that why that was true was staff didn't have the knowledge or the equipment for the structured activity part. So staff were they weren't well equipped or didn't have the knowledge to kind of lead structured activities with the kids. So what we're going to build into our next HEAL training is really inexpensive and easy ways that they can lead structured activities with the children, either inside or outside on the playground. Next slide, please. And this last data slide just looks at the different centers. So we just picked the cohort that we had in the spring to show kind of how much each center improved. And the change, as you can see, was really variable, centered by center and by category. So the center's total assessment score ranged from about 9% to a 21% increase in their post-intervention scores. And each center was able to increase their score in most areas by at least 1 point, and then all were able to increase their score to about 20% of the maximum in at least one category. So one thing we're going to continue to look at is, this is pretty good improvement over the short term, but will they be able to sustain that? So that's where we're going to be doing some long-term evaluation with our childcare health inspector when she's out doing her childcare inspection. And then next slide, please, last one. So, basically some of the challenges were the staff who did attend our training were really motivated, really excited, really interested in doing this, but just were not always able to make those changes when they got back to the center. Also, we had a little bit of turnover, as is very common in childcare, so we would train, a few of the people that we trained, they're no longer working at the center. So, and before they really got to get things implemented and going, they left the center. The other thing that we were really surprised to see were we had about 9 centers who were eligible to participate in CACFT and weren't participating before HEAL. We really worked with them to try to get them signed on to CACFT, and in the end, 0 were actually did sign up. And so, what we asked them, what were the barriers? And I think it's some of the things that probably a lot of people have heard that gets associated with CACFT is that the thought of this overwhelming paperwork, and some other sites told us that, the director just would not make that final step to call or to make a commitment to CACFT. They understood that it would be good for their childcare program, but they just felt that administratively it was going to be too much of a burden. And then we had one center find that there was some barriers when she tried to call and get signed up. She just couldn't find the right person to talk to in the program, and I think she was referred to a Loveland or a Fort Collins Bright Horizon to see if she wanted to combine efforts with them, and she didn't, so that kind of just fizzled. So, you know, we're going to continue to really look at trying to get centers connected with CAC. I just feel like it's such an important way for them to improve nutrition, and they get so much support from the program that long term it would really help them maintain a lot of good nutrition choices there. So that's the end of my slides.
Thank you so much, Sarah. It was very helpful and hearing about your successes and challenges. I heard a few people chime in. If you could just go ahead and state your name and agency you'd represent, that'd be great.
This is Carla with Mesa County.
Hi, Carla.
Hi, it's Ann Kyrie joining you.
Hi, Ann. Thanks for joining.
So before we move on to our next speaker, this is Tracy. I just wanted to comment on one thing that Sarah mentioned about the 5210 tool. So when I learned, I had an opportunity of attending a visit with maternal and child health staff here at Boulder County, and to hear from Sarah and all the successes that she just shared with you. When I learned about the use of the 5210 tool, I came back to the department and asked some questions of our evaluation team. And reason being is because in the near future, I'm going to be in touch with all of you that have gone through the planning process and doing the strategy around the impact evaluation. And so correspondence will be coming from me soon about that. But what it entails pretty much is a way that we can all collectively look across all of our counties, across all of our efforts about the impact in Colorado for these strategies. So, and one of the components of that is aggregate data collection, or pooling data to have a bigger sample size and make better inferences about the success of the strategy in Colorado. So what we did determine is that the 5210, the tools that are in that package, and the Let's Move tools, they're definitely, cover the same types of concepts, and as you heard from Sarah, there's some benefits that Boulder has certainly found in using that tool. It's absolutely okay if that other agencies take a look at that tool and maybe compare it to the Let's Move tools and see which ones would work best for you. But as far as an impact evaluation standpoint, we're still going to be able to use the data from those tools and have both of those tools produce data that help us answer some of our evaluation questions. So we don't anticipate that being any problem, the use of different tools. It does give us a little bit different data, but we can just look at it in a different way to answer those evaluation questions. So I wanted to put that out there to all of you so that you're aware of what that means as far as the impact evaluation. And again, that might make a little more sense when I am able to get the correspondence to you about the impact evaluation. So I just wanted to make that note, and if there's any questions, I'm happy to answer them.
Great, thanks, Tracy.
Thank you.
Okay, we're going to go ahead and move on with our next speakers. Mike Schwan from Weld County Public Health and Janet Atterbury from Providers Advancing School Outcomes, or the PESO program.
Good afternoon, everyone. Thank you, Sarah, for sharing your work with us in Boulder County. Your work with the PASO program is very similar to what we're going to talk about today. Janet and I, we went about it a little different twist. Looking for the slides. Okay. Oh, so it's interesting how similar the work is, though.
Great.
And I want to allow Janet to talk a little bit more in depth about the PASO program itself. And so I want to, it's a privilege to introduce Jeanette Atterbury from the United Way PASO program. She's here with us today. And we first met at one of our community health campaign meetings, and we learned about each other's work. We had expressed a need for nutrition education. So I want to introduce Jeanette, and she's going to talk a little bit about the PASO program over the next few slides. So go ahead and advance it to the next slide, please, and I'll let Janet take it away.
Hello, I'm Jeanette Atterbury, and I work for United Way of Will County, and I am the SFA PASO program coordinator. And pretty much we Boulder County and Will County, we do the same work in the PASO program. We both train we work with Latino women that are taking care of children between 0 to 5. And we work with extended childcare providers, meaning that they don't have license, but they do follow the criteria of extended childcare providers through the state. And what the purpose of the program is to train the childcare providers to have a better quality of childcare for these children. And in the sessions, what we do, we work with, we do different sessions as of child development, literacy, math, social emotional. We also do, we do have sessions for nutrition, which is very important, and that's what we do. If you can pass to the next slide. The program, it's about a year, and it takes 30 sessions, and we meet twice a month, every other Saturday in the morning for 3 hours, and the total amount of training hours are 130 hours. And like I said, we do literacy, language, early math, communication, child development, social emotional, physical health, and nutrition, and other topics related to school readiness. Next slide. We also do provide, or we do have a TS, which is mentors. This TS go and do home visits twice a month to these childcare providers to ensure that whatever they're learning at the sessions, they're implementing at home. Or if the childcare providers, they have extra questions related to the past session that they had, so the TS will model for them and answer questions also. They will model for the providers how to interact with the children, and all this is during the visit. And the visits last about hour and a half. It depends on the necessity of the childcare provider. Next. Here we're going to have some pictures. This is our last class that we had, nutrition. At the beginning of the class, what we do is we divide them in groups, and each group, they have to do some activities with the children at home. And the activity that they've done that past week, they bring it to the class or to the session, and they share with the other providers. So that way, each provider, they're building their own portfolio of activities and related to language, math, physical, and things like that. So, pass the next picture.
Okay. Thanks, Jeanette. So I'm going to talk a little bit more in depth about the training that we provided. And for those who may not be familiar with the use of promotores means community health worker, and the promotores model reaches underserved or hard-to-reach populations through peer education. The model is based on the premise that minority or immigrant populations can be reached more effectively by building partnerships with members of their own community in order to tap into existing community networks and provide health education in a culturally sensitive manner. Clients are more likely to trust a member of their own community than they would an outsider, such as myself. So we used the Promotora model for this training. And we first provided the EPAP training to the Promotoras and TIAs. And then the actual training for the providers consisted of 2 Saturday mornings that lasted 4.5 hours each morning. TIAs then visited each provider similarly the way that they did in Boulder County to reinforce the EPAP messages, and will continue to provide coaching throughout the year. Next slide, please.
The amount I guess the participation that we had in the last 2 or the first sessions that we gave, Mike and I, it was about around 35 childcare providers present at one session. I mean, in both sessions.
And the presentations themselves were prepared utilizing resources from our toolkit that's provided by the State Health Department, including Let's Move Childcare, Mealtime Active Play Partners, Knapsack, Washington State University, and Idaho State University. And based on Jeanette's experience with this group, and also on the results of their self-assessments, which also we utilize the Let's Move Childcare self-assessment quiz. We didn't have them do it online, but we printed them out, and they took that self-assessment the first Saturday morning right off the bat. And that it revealed that the greatest need for training was on the areas of healthy eating, responsive feeding, and hands-on meal preparation. So we decided to narrow down the training to these areas and look forward to providing areas in physical activity and adequate sleep time in the near future. Each provider created an individual action plan with goals and target dates, and will receive coaching to complete their goals during the TIA visits. And we just, this last Saturday was the second Saturday of the training, so the TIAs are looking forward to working with each provider and providing coaching on an individual basis according to what their action plan entails. And when they are completed with their action plan, then they can take the self-assessment again and receive a certificate of completion, which this next slide reflects. Something that was very evident during the trainings was how engaged the providers were during the training. It's obvious that they take a lot of pride in caring for the children, seem very receptive to making healthy changes in their home. Jeanette and Carolina, who is the TIA involved, are planning on recognizing their achievements by rewarding these certificates during the group trainings. And the next few slides are some pictures. This picture is a picture we took during our training, and you'll see up front there, that is our Promotora. And I received permission to talk a little bit about Juan Gomez, who has been working for the health department as a Promotora for the last 3 years. But his initial experience with our health department was actually 15 years ago when he was somewhere around 7 to 10 years old. He and his family were involved in the HCP program here at Will County. And now it's really a great story because Juan is 22 years old, and he will be receiving his master's in public health next year. Next slide. Part of the training last Saturday involved meals, healthy snack preparation, where the ladies divided up into 5 different groups and prepared healthy snacks that they consumed along with the children next door. They had some snacks Petrillo for allowing us to use her materials from Cooking Matters to do the meal preparation. And the next slide. And there's a group picture of all the providers together and Juan in the front there. And I think that's it. Janet, do you have anything to add?
No, I mean, we're very thankful for the partnership that we started here at the Health Department and continue to forward to look for working with him in the future new cohort.
Yes, and you're planning on expanding, aren't you?
Yes, we're going to open another cohort in Fort Lawson area. Right now, the group of ladies that you have seen, all of them are from Greeley area. But in the next month, we will open a new one in Fort Lawson.
Great, such exciting work. That's such a great partnership. We'll go ahead and move on. And with Ann Kyrie, who is our Let's Move expert. And so I spoke with about 4 or 5 of you about a month ago. I know there were some concerns about using some of the online resources that we had recommended for Let's Move. So I thought this would be a great opportunity for you all to ask Ann directly just how to kind of work through some of those barriers and challenges. And it sounded like Mike had a really good idea with printing off some of the self-assessments and actually taking them to the providers. So that could be another good option. But it is very user-friendly, the Let's Move website. And so I'll hand it over to Ann and she can answer your questions or maybe give a brief overview of the Let's Move website.
Hi everybody. It sounds like it's been a challenging afternoon and I get to come in at the end of the show and try to see if we can answer some questions and do some good wrap-up for you. So please feel free to jump in. I'm not sure how you have it structured right now, if everybody's on mute or not, but this would be a good time to just really talk through some questions that you have. Hopefully everyone was part of the first presentation, and if not, the good news is that these slides hopefully will help you navigate the system. And as you look at this first slide, you can see the website, and that's a great place to go to just to get in there and play and have a look. If you can go to the next slide. So I'm going to do some really brief background, and I'm just going to kind of make this go pretty quick. But Let's Move Childcare is an effort from the White House and specifically the First Lady talking about promoting children's health. And we've all heard a lot about Let's Move. There are lots of different settings where we're addressing Let's Move. School-age care, there's, as you already referenced, the Let's Move for Latino families. There's Let's Move Indian Country, so there's a lot of places where this is being done. And the great news is that it's been recognized that childcare is a definite place where health and nutrition and physical activity can be addressed. Go ahead. So there are still 5 goals in the Let's Move childcare system, and they're physical activity, screen time, nutrition, beverages, and infant feeding. And so I'll let you, hopefully you have a copy of these slides so you can look at these if you need a little more information. And I think the nutrition, all of those are important to all of you. So as you're working with childcare providers, they can see the importance of this. And so there are some steps for providers to do this work. It's on here. The www.healthykidshealthyfuture.org is the place to send them. And, you know, it might actually be helpful at some point to just even sit down with a provider and help walk through this. And that way you can see what they need to do and how the system is set up. Once you're in, it's pretty cool that they'll send the providers some online tools. They'll send some emails with some suggestions. And then at the end, there's an opportunity to get recognition. And I think where you guys were all looking was building the action plan. So let's move on and try to look at a couple screens and then get to the action plan. So there is a quiz, and you don't have to go back to that. But once the quiz is taken, then we get to the action plan. And what you see in front of you right now is a sample action plan. And this is where I've seen some questions. But if it's followed according to, some of the goals around Let's Move Childcare, hopefully you can see how this can be very helpful to a provider. So on this one, the goal is drinking water is available inside and outside where it's visible and available for self-serve. This is one of the quiz items, so depending on how the provider answers that, I'm pretty sure that it will always come up as an action plan because this is an area of importance. So then the provider has the opportunity to go ahead and enter how they want to move forward in order to make that happen. The second one talks about the sugary drinks, and then they can make a goal. So for each section on the quiz that the provider answers, there will be an action plan and steps, and it'll give sample, and it'll pull this up so that they can set some goals.
So I think
Next slide.
Okay.
Go ahead.
Well, I was just going to say, are there any questions at this point regarding the action plan? Because I know there were some concerns and worries that it might be overwhelming for some child care centers. Does anyone have any questions or comments on the action plan? No? Okay, move on.
All right. So one thing about the action plan is that really not every single section has to be completed. The provider can actually choose their priorities on where the action plan. So in hearing some of the feedback, this could be a place where you might hear back from providers that if you attack every single one of those quiz questions and all of the action steps and goals, I can see how it could be overwhelming. And so in that, it might be worthwhile to kind of maybe help and prompt and review what is important and kind of looking at what is achievable for the provider to begin with, and then make some action steps that will be achievable and are things that the provider can reach in order to move forward. And then this is also a great place, if you have a copy of the action plan with the steps, then perhaps that is the tool for you to have the conversation with them about Let's Move Childcare and some of the nutrition practices. Are there any questions? I hope to have kind of a dialogue with this. Is there anyone out there that's used this with a provider and has experienced their frustration or they're having trouble?
I'll just talk from Boulder. We found that action planning in general is challenging for healthcare providers that we work with. The whole concept of setting goals and timelines and things like that is a skill that they're not really familiar with, and it just takes a lot of kind of nurturing and helping them and kind of helping them write the goals and just really getting in there and helping them create these action plans is really helpful.
Okay, so they're needing a lot of coaching then to actually get to a point where they are able to really put something on paper or in the computer system even?
Yeah, that's what we found.
Okay, and I can see how, I think about people getting frozen and sometimes when they see things like this, you don't want them to freeze up. You want them to be able to think through it. Because, and again, this is something that they're familiar with and they work with these types of things every day. So I do appreciate you saying that it does take a lot of coaching and working with them. Now, on the website, there are samples of action plans, and so that could be a tool to maybe help them maybe look at another sample action plan to see where might I fit in this, and does my program run in a similar way that I can create an action plan from the sample. And I've also had success in working with programs on basically talking it through, but again, like you said, it takes time and it is coaching. Tell me how you address sugary drinks. And, you know, that's actually a part on the quiz. So you might even want to get a copy of their answers to the quiz if they're willing to share that with you, because that does give you some information, too, on how they answered that and how they see themselves.
Yeah.
You know, and if it would be helpful for us, you know, one follow-up step is if it would be helpful for us to pull down some samples for you, then if you have trouble getting to those, then let us know. We'll make sure that you have some good samples.
I think that would be really great. If you want to just go ahead and send those to me, Anne, I can send them to the group. That would be helpful.
Okay. And then what about a copy of the quiz? Would that be helpful too?
I think
so you can see what the quiz questions are?
Yes, the copy of the quiz, and then also even the action plan, like the sample, or
like a clear.
Yeah, before there's anything in there, I guess just the template maybe. So if people are more comfortable writing it out, that would be helpful as well, and then entering it.
So this is Tracy, just wanting to do a little time check here. It is 3 o'clock. We can stay on for a few more minutes. It will, I believe we can with the webinar, right? We can stay on for a few more minutes so that people can ask the presenters questions if the presenters are able to stay on. But otherwise, if those of you, I want to be respectful of time, if you need to move on to something else, I just want to thank you for joining today, and feel free to sign off as you need to.
So Tracy, will we have access to the slideshow, the whole slideshow for the Prezi?
Yes, yes. This was recorded, so I will send out a link to the recording.
Oh, thank you.
Sure.
Are there any additional questions for Anne or Mike and Janet? Oh, Sarah.
Sarah and Janet.
And Janet.
If we can just, Tracy, I hate to ask, and Jody, if you have any more questions of me, I have another call in on right a second too. So, but I want to absolutely, my contact information is on here. So if you do have questions after you get off of this, after we get off here, don't hesitate to shoot me an email.
Thanks so much.
I'm happy to answer it, and I'll get all that other information out to you.
Great, thank you so much.
All right, so I'll go ahead and sign off now, and thank you for letting me come and talk to you for a couple minutes.
Great, thank you.
Thanks.
So are there any other questions for the presenters?
I'll start it off. I have a question for Sarah.
Sure.
And you had mentioned partnerships to provide the PASO training that various folks were involved. I'm curious to hear how, if you established any partnerships to provide the training to the centers, and what length of training that the child care centers themselves receive.
So I'm sorry, I didn't quite get that. So what, you're asking about partnerships that we have?
Yeah, who provided the training? Were you able to partner with others to provide the training to the centers? And
yeah, so
how
it
was the training for each child care center? And how did that look like? Was that on an evening or?
Oh, okay. Yeah. So we had the child care staff come to our office where we have kind of a training room. And so we did 3 sessions that were from 9 a.m. to 1:30 p.m. on 3 different Saturdays.
Were they with the PASO program as well?
Yeah, so what we did, we trained the TIA, two of the TIAs who worked with family, friend, and neighbor providers. So the providers themselves, the Latino home providers didn't come to our training. We trained the TIAs, and they went back and provided the information and the coaching to the providers that they worked with.
So staff from 20 different child care centers attended the 3 trainings that were on.
Yes,
okay.
and 2 TIAs as well.
Right. Okay, thank you.
Sure.
Any other questions for Mike or Sarah?
Or helpful?
Mike, I was just wondering, or Jeanette, so you said that the providers were going to kind of develop some kind of action plan to implement, and then you were going to do a post-assessment with them?
Right. Yeah, so we developed just a form for their action plans that was very similar to the Let's Move Child Care Action Plan, and that we gave them that as kind of a homework assignment that they'll be receiving coaching on completing the action plan with the TIA during their individual home visits, and then they will take the assessment quiz again when they have met their goals so that they can receive their certificate. Does that make sense?
Yeah, that sounds great. I'd love to see what your results are when they've completed the post-assessment.
Yeah, we're looking forward to those as well.
Yeah.
Any others or any helpful resources that other communities have ran across for this strategy?
I just have a question. Is anybody going to be going to CPHA? Be really fun to maybe have time to get together and share resources at that point, or is there another learning circle scheduled for ECOP that we might continue to share this information?
Yeah, we can always have more check-ins. There aren't any scheduled at this time, but I am going to be getting in touch with you and just kind of get a feel for how these are going and kind of the next steps for keeping in touch. But I would be open to having another learning circle, maybe a couple months, just to check in with everyone and see progress, if you would be open for that.
That'd be great.
Okay. Sounds good. Okay, well, if there aren't any other questions, we'll go ahead and end. I thank you all so much for bearing with us and participating today, in spite of all the technical difficulties. But I will be sending out this recorded link, so if you have colleagues that missed this, you can shoot them the link so they can they can listen to it and see it. And then you'll also have a copy of the Prezi and all of the slides. So thanks so much again. Thank you so much to all of our presenters, and have a great afternoon.
Thanks, Jody.
You're welcome. Bye.
Bye. Thank you.